All right, thanks so much, Nick. Well, right now we know that heart, lungs, and brain get a lot of attention when it comes to health news, but this month is a time to actually pay attention to your kidneys, an organ that many people don't know a lot about.
That's right, and so important. 37 million Americans suffer from chronic kidney disease, so we're honored to be joined live and in person by none other than Dr. Desai, professor and chair at primary care at Kansas City University, to fill us in. Now, I'll confess, Dr. Desai, I didn't realize that the kidneys had a month. You know that this is, but that just goes to show you how important they are.
No, they are very important. Toenails do not have a month, but kidneys definitely do.
And that's for good reason. So for people, who maybe, what's the primary function of kidneys?
Well, I think most of us know that they make urine, but most people have 2 kidneys, some people have 1, and each one has about 1 million little filtering units called nephrons. So they filter the whole blood of the body about twice an hour, taking out waste and toxins. They also make hormones that help make red blood cells, convert vitamin D to its active form, and also modulate blood pressure. And they help balance out water, sodium, and minerals. And if they stop working well, you can get a buildup of these waste and toxins.
So what is chronic kidney disease and what causes it?
Yeah, so chronic kidney disease, as the name implies, is something that affects the kidneys that has been going on for over 3 months, where they lose that ability to filter and you get a buildup of those toxins. And you know, the scary thing is that 1 in 7 Americans has this, and 90% don't know because they may not have symptoms. The most common cause are high blood pressure and diabetes, but there's other things that can affect the kidneys as well, like infections.
Man, and so, and what are some other symptoms? Like, I'm just, like, if you look jaundiced, is that like a urban legend, or is that a symptom?
That's more if the liver is failing.
Oh, my bad.
There.
Okay.
Yeah, so I guess the other thing is we don't know a lot about our kidneys, but they do so much for our body and how we operate day to day.
Did you just say that, like, if you have 2 kidneys, they filter your entire blood supply twice an hour?
Twice an hour, It's really remarkable.
That's amazing.
And with 1, because we've heard of kidney transplants. 1 person can survive with 1 kidney. Kind of explain, like, what happens with 1 kidney. Does it kind of slow it down with functioning? Or?
Yeah, so our body's designed, pretty well. You can lose half the liver function, still do okay. You might get a little jaundice, but even with just 1 kidney, your body will still be filtering, but it's a little bit slower process, and so it has a little extra work, so you have to take extra care of that 1 kidney.
Gotcha.
And what about, I've been lucky enough, I haven't had to deal with this, but like a kidney stone, is there anything you can do to prevent that ordeal?
Yeah, just staying well hydrated will definitely help with that, so drinking a lot of fluids, and then depending what kind of stone it is, you might want to avoid certain foods.
Yeah. So tell us about the Kidney Social Summit that's coming.
Yeah, so this is something that's designed for patients that have chronic kidney disease, and people can just interact with each other and find others who have the same condition and learn some more facts that will help them increase the life of their kidneys and maintain good kidney function.
Okay, so this is a class, they're virtual on Zoom, going to be March 29th from 2:30 to 5:15, and again, it's free to attend this, and just basically learning how to protect your kidneys.
Yeah, and some of the early participants will get a little thing from the National Kidney Foundation, a little swag bag.
Oh, okay, I like a swag bag.
Yeah.
Before what else should we know, like, just to make sure we're taking care of our kidneys?
Yeah, so if you have any risk factors, which are over the age of 65, anyone in the family has kidney disease, if you have high blood pressure, diabetes, or African American, Native American, Asian, or Indian Asian, then you should take care of them by knowing your numbers, as we always say. Keep your blood pressure less than 130/80. Try and avoid taking too many over-the-counter pills. That can sometimes affect the kidneys. So if you're exceeding the doses for aspirin or ibuprofen or naproxen, then that's something to be really careful for.
Gotcha. All righty. Good stuff. Dr. Desai, it's always a pleasure.
My pleasure, Crystal. Very nice to see you guys.
Cool.
Good to
Thanks
see
a
you
lot.
as well. Great information for us.
Thank you.
All
Marcus?